Next this morning, there's a big emphasis on training and education at the Union, strengthening lung health efforts by building clinical research and advocacy skills worldwide. Well, the training the Union offers is a mix of international, customised and free online courses, all equipping healthcare professionals to tackle TB in high-burden regions. And to look at this in more detail, I'm joined by Lara Garrido, who is Director of Training and Education at the Union. So great to have you here, Lara. Back on the show again. I know you were with us last year in Paris. So let's start with looking at how the Union can actually help with capacity building.
Thank you. So the Union works with national TB programs in low and middle income countries. We actually work with them through projects or invitations to provide technical assistance, and our expertise is to identify international guidelines that need to be interpreted, expanded, and transcribed into national guidelines, but with our focus on implementation. So always bridging the gap between the policy and the practice. How is this going to be implemented? And through this collaboration, there is normally, we identify training needs. So the countries might invite us back to deliver some trainings based on those guidelines that have just been developed. Or they might decide to send a group of their staff to one of our international trainings, and also gives us an idea of what kind of training is needed and why. So that's how we provide all the resources to the countries that need them.
It'd be fascinating to know who are the experts behind all of these courses. I'm sure there's a multitude of them.
Yeah, so I don't work on my own, obviously. We work with really good international experts that are well known. They are all here at the conference as well. They are well-known names. So, for example, we have 5 international courses coming up, and I will talk about the directors. Obviously, there is a team of faculty, but I cannot mention them all. But, for example, our basic TB course, which is the principles of TB care and prevention, Dr. Rita Dotlo, she has been working for the Union for about 30 years, delivering trainings, delivering technical assistance. She's a senior advisor at the Union, and she's based in Zimbabwe. Our director for the same course in French is Dr. Kopto Kura, and he is our director of TB department as well. And he's based in France, but he travels every year to Cotonou to deliver this course. Then we have another course on the clinical management of drug-resistant TB, and we have a worldwide figure, well-known figure, Dr. Chen Joan Tiang, who is from the Taipei Medical University, so the course takes place there. And the same course in French, we have Professor Giselle Badoum, and she works in the Yalmata Ouedraogo University, Medical University in Burkina Faso. And then we have a new course on child and adolescent TB, and we have Dr. Stephen Graham, who works with the Melbourne University in Australia. So very well-known figures.
Wow, a real array of expertise there to pull on. And you've already alluded to some of the courses, but what kind of courses do you offer in general? Is there any you want to highlight in particular?
So in terms of content, our courses focus on the programmatic implementation. There are many clinical courses out there and courses for academics run by universities, but our added value is the fact that our experts, they work with national TB programs in the implementation, and they see what the challenges are. So we have, in terms of format, we offer online, but we also offer in person, sometimes combining both elements to save and be more effective, but the in-person is so critical. It's where we go into clinics, into hospitals, where we go into laboratories, and we study what is happening in the implementation, what are the challenges, and then we have discussions. It's very, very interactive, and it's all about the implementation.
Yeah, and I think that interactive element sounds very well worth it, doesn't it, as well? So rather than just telling people that interactivity, that's the way you learn, really, isn't it?
Yes.
And a two-pronged question now. Who attends the courses, and who do you think should attend them?
So for our international courses, it will normally be staff of national tuberculosis programs, working at national and subnational level. We also have medical officers, nurses, and radiologists, laboratory staff. We also have training, monitoring and evaluation officers, and anyone working on the management of health services provisions, and many training officers that come to our course to then take these knowledge and resources back home and replicate. For the online courses, they are free, so anyone really can take them. I've taken some. I'm not a medical doctor, but obviously they are designed for the same audience: medical officers, nurses, people working in laboratories, radiologists. And then the customized courses, it depends, because then we build the course according to who is going to be in the room. So for NTPs, national TV programs, they will ask us for a specific card to deliver this course. We also have delivered courses for researchers and for medical officers of international organizations that work in high TB burden countries.
Well, so there's something really for everybody. Lara Garrido, Director of Training and Education at the Union, thank you so much for joining us.
Thank you, Nadine, for having me.